Dr. Don Funk from Movement Medicine in Montrose, Colorado. Today I'm going to be talking to you about a problem that I keep seeing again and again recently. And it has to do with hip pain and knee pain and how it kind of all ties together. So somebody comes in and they say, well, I've had this problem on my left, I had this problem on my left side years ago where I had this knee replaced, I had the hip replaced, or I sprained my ankle, something happened on one side, and now years later, they're having a tremendous number of problems with their opposite side. And I want to explain to you why that happens. So let's say that on this left side, this is this person looking straight away, and they have a problem in this left knee or in the hip joint, and it gets fixed. Well, what happens is when that is a problem over here, what we'll do is favor the right side. And when we start favoring that, we start shifting the weight to that right side. And the reason we do that is because these muscles start to become weak and overworked. So this muscle is designed to stabilize the pelvis when we lift the other leg. So when we start taking weight off of this side and shift into this side, what happens is we have to work this glute medius really hard, and then that pelvis shifts to the side when it becomes too much for it to handle. When that happens, then this is like a bowstring here, this iliotibial band and tensor fasciae lata. It's a muscle up in here and then turns into a broad band that comes down around the knee. And when it shifts to the side, when we shift to the side, it stretches that band, and then we get that pain in the hip and down around the leg. At the same time, we start having problems with the psoas muscle. And the psoas muscle runs from the front of the spine down to the inside of the leg and does this. Well, when that happens, when it gets tighter on one side, it causes a twist in the pelvis. And then because it's a ring structure, what you're going to have is sacroiliac joint pain because that pelvis is rotated, and that causes pain. And that causes these lumbar vertebrae to not work properly. The lumbar spine is really designed to bend forward and back. It's not really good at rotating. And now, because the pelvis, instead of moving in that nice figure eight, now it's kind of catching as we go and causing a lot of shear forces in that discs and the joints of the low back. So what we need to do is make sure that this, on this side, the original problem is corrected. Then we can start focusing on this. We'll start doing some lacrosse ball massage on that. There's a video on that on this channel, and you'll be able to see in clear detail how to do lacrosse ball self-massage on this lower extremity, which is going to help to relieve some of the spasms in the muscles and loosen up that fascia so that there's a little give, because that fascia in this area is connected all to all the other fascia in your entire body. So if you have problems here, you may have problems in your neck or your bottom of your foot. It's all connected through the fascia. So what we need to do is loosen that fascia up, and then we can start strengthening these muscles so that they can again stabilize the pelvis. At the same time, we have to make sure that this problem that originally started it is corrected. That's a lot to ask for a lot of seniors that have been involved in athletics for most of their lives. So I'm going to show you some different exercises that we do specifically for that. Very often we ask people to do squats. One knee will bow in, or the other knee will bow in, or sometimes even both. And then of course we want to do the lacrosse ball self-massage, and I'll leave a link below in the description about how exactly to do that. I have a whole video on that. Next, we want to find ways to isolate those muscles in the gluteals, and we can do that by doing single leg exercises. And oftentimes we need a band around that knee so that it doesn't roll in. And by doing that with support, we can start exercising those gluteals and strengthen that area so that that knee doesn't roll in and that hip doesn't shift to the side so much. This can take some time, and it only takes really a few repetitions, and you'll start feeling that in the gluteals. Next, we'll work on some standing exercises, and with a band, and if I'm lifting my left leg to the side like this, it's my right gluteus medius that's firing. And then my left tensor fasciae lata that's firing. So we're getting the whole picture there, and by doing it standing, we're developing some balance, which is very important to get that correct information coming from the ankles, going to the brain, and firing those muscles down through the nervous system to fire them correctly. And we'll do those in 3 different planes. Then we need to do some movement patterns to increase the range of motion in the actual hip joint. And it's best to do this standing because of the neurology. So we can step around, and that's going to be stretching in internal rotation. And then we can also do the other side. And you may notice a difference from side to side, very common, and that's a clue to what the actual problem may be. Then we can start doing steps to the back so that we can do external rotation in that hip joint. Should be symmetrical side to side, because when we start to lock up in that hip joint, we start to get low back pain. So I hope you found that helpful and gave you some ideas about how to work in the gym and how to strengthen those muscles, maybe loosen up some of the tight muscles, and how to build strength. It really helps to have a really good personal trainer to look at you and see how you're moving and help you understand maybe you could just tweak that knee a little bit here, move that hip a little bit there, and it's going to make that exercise so much easier and more effective, because our body wants to search out the easiest way to do the exercise. And sometimes it's the more challenging method that we need to do to activate those muscles that have become weak, overstretched, and overused. So thanks for watching. This is Dr. Don from Movement Medicine in Montrose, Colorado, and I'll look forward to seeing you soon.